as we had promised a month ago, we would try to do this on a monthly basis, at least to keep the Board of Supervisors up to date on COVID and also to answer any questions you may have. I've got Jack. Jack has joined us, as you know. I believe Dave Harrison will be joining us. Rob Lagonia, Sarah Sterling, Tistria's on, that we can probably answer questions. These are people that are on the EOC calls 3 times a week. So we can sort of keep you up to date. Why don't we start with Jack in terms of what you've been doing?
Well, I'll start with the numbers. The numbers are down. As everybody knows, our rolling 7-day average is, I haven't actually looked at it in a couple of days, but I think the last I knew it was under 3. This morning we had 11 positives. That's a far cry from where we were post-Thanksgiving through the holidays, where some days we had 70, close to 60 or whatever. It's nice to see our hospitalizations are down. This morning it was 10. That's down. That's a third of what it was just a month ago. We have had 86 fatalities. We haven't had any in the last couple of days, but the last one was a community member who passed. I believe that the biggest bubble among nursing homes, I know that the biggest bubble of nursing homes was Ghent rehab. We have 19 residents there who have died since January 1st, and one staff person who actually was 76 years old. God bless her, she was still working. But things are going in a very positive direction when it comes to the numbers. As many of you know, last week, because of the weather, particularly in the Kentucky area where most of our vaccines come out of, we did not get vaccine last week. We did not get second doses that we were owed. They all came this week, and we, as of this afternoon, at 4 o'clock, we were successful in catching up last week's and this week's. So we've got all those are second doses. Tomorrow we have 200 1Bs, which are consist of firemen, grocery store workers, potentially restaurant workers, etc. We have 200 in the morning, and then we have 200. We're starting our comorbidities in the afternoon, and we are requiring a letter from a doctor that basically says what the individual's comorbidities are, so that and this is a sort of a sticky wicket for me, because I know that some people can have a hard time getting a letter from a doctor, but if I have a senior show up who comes down the aisle with a walker and oxygen, I know that person has comorbidities, and if they don't have a letter from a doctor, I would be hard pressed not to put a needle in that person's arm. But at the same time, as I have a apparently healthy 25-year-old who shows up and says, I have comorbidities, I really need to know, what this is. And so we are requiring a letter. And the 100 of the comorbidities that we're doing tomorrow, the call center set up, they did make individual phone calls to people, and they basically said you need to have a letter from your doctor. The other 100, we got our doses this morning for the second 100 for comorbidities and the second 100 for 1Bs. And so just before we headed over to the pod, we got them. They arrived, and so that's when we decided to open it up. And it was the free for all. I'll just go ahead and have people sign up. My understanding is those have filled, so we're ready to go. We see some duplicates on the list, so we're kind of one of the staff here is paring that down a little bit. It'll open up a couple more spots, and they'll fill right up because people are watching it. Mm-hmm. So that's been the week. Some of you know that we were asked. Matt was asked by the governor's office if we would participate in the pop-up pod, and they are doing pop-up pods in the capital region, and they're using Mohawk Ambulance to do the vaccinating. And since this is our county, we wanted to be the ones doing the vaccinating, so we agreed to do that. The city of Hudson is developing a list of people who would be eligible. They have to be eligible. It can't be just anybody, but we're doing it at the Hudson Firehouse, March 6th. That's next Saturday, 10 to 1. And the call center is going to set appointments once that list is finalized. And hopefully we're going to be able to address folks from the minority community, as well as, just low income in general. Again, they have to be in a category that's that we can vaccinate. So they would have to be seniors or folks in the 1B category or people with comorbidities. So that list is in the process of being developed.
They used a census tract, which includes, which is the most depressed area, I believe, and it was part of, or most of the second ward and part of the fourth ward, if not all the fourth ward. But that's the second census tract that they used, and so it's going from there. I actually talked to the mayor today, and he's the one that got us the fire station. So I think it'll be positive. It's the population that they're talking about, as was told to me, would, you know, in a lot of cases would be at the back of the line, and this sort of moves them up in line and gives them the opportunity to get the vaccination. So you know, we're pleased to be able to help. This is not coming out of Columbia County supply; it's coming directly out of the state supply. So you know, I think it'll be positive. And actually, I've talked to Kevin McDonald, and we're going to use the 2 OFA buses to transport people from certain areas within the two wards. I think the Bliss, in front of Bliss, there's going to be a bus. They can only transport 3 to 4 at a time because of social distancing, but at least if people need rides up to the fire station, they'll be able to get them.
Brenda has her.
Just a comment, Matt. I appreciate the fact that you left me out of this conversation since I'm the 4th Ward Supervisor. I had to find out for myself, so I appreciate that neglect, just to go on the record.
Okay.
Do we know how many people will be vaccinated in this pod?
It's 100. We have 100 doses.
100 doses?
Yeah.
Thank you.
And that's, as Matt said, that's coming off of the state supply. It arrived today. It's frozen, and we're going to keep it frozen. And you know, we also got. I should also say today that we also. So we were asked by the state health department, as some of you know, CVS and Walgreens was contracted to do nursing home staff and residents, and they've gone through and done everybody that they could do, and they've moved on now to their individual. You know, stores and what they can do with seniors. We were contacted by state health to ask if we would help to do the maintenance on nursing homes. In other words, new staff, new residents as time goes by. We said yes, readily said yes, and we got 100 doses of Moderna vaccine for that purpose today. That also arrived frozen, and we're going to keep it that way for the time being. The state is going to provide us a list of the nursing homes in the county and what they need. So they turn in some form to the state that says that we now have 3 staff people and 2 new residents or whatever. We have to do this in lots of 10, otherwise we waste vaccine. So that's our job to coordinate that. But the nursing homes come and pick it up, and the nursing home is responsible for there. And so we're just a distribution point. Very happy to do that.
Okay. Any other questions for Jack?
Sister has her hand up.
Oh, I'm sorry. I wasn't looking for hands. I apologize. Supervisor Holding?
So I just want to thank Jack and everybody working so hard. I know being on the 3 times a week call, you're putting together a plane while it's flying. You know, things are constantly changing, and it's a lot of work, and you guys are really doing a great job. So I want to acknowledge that. I also was wondering, Jack, if you had any idea if comorbidity doses are going to go to pharmacies at all. I know we've obviously just started comorbidity. It's very limited in the capacity. I know a lot of people who are trying to sign up through pharmacies that are being told right now it's only for seniors. Have you had any insight as to whether comorbidities is going to open up through other avenues other than the county?
Well, so I would hazard the guess that it probably won't go to pharmacies, just because if you look at seniors in general as a category, there's thousands of them. I think they're going to take a long time to get that done. People with comorbidities can go to the state mass vaccination site. I guess I find myself, now of course, some of those sites are drive-throughs. They would be safer, if you will, than our pod at Columbia Green, because we do socially distance everybody, but they're inside and whatever. But they can go to those are the avenues I think that will probably stay open for them, folks with comorbidities. And I do think that based on what we're hearing, and as you know, things change a lot quickly with the governor's office and the state health department. I think we're going to be doing comorbidities for a while. We're going to be getting doses. I think we're going to get a slight increase when the Johnson & Johnson vaccine comes around. But they're talking about 20 million by the end of March. You spread that out across the country, it's not a lot to Little Columbia County. So I do expect some slight increase, but I also expect the 200 to 250 a week probably for the next month.
Okay, great. Thank you very much.
Any other questions for Jack?
Jack, I had someone ask me today, whoa, was that for me? I had someone ask me today about the Johnson & Johnson. I think after all this woman has read, and she has issues, do you know when that will be available?
End of March.
Because the news reports tomorrow.
Yeah. Well, I think what I heard this morning was by the end of March, we'll have 20 million doses out. So I don't think they're going to push 20 million doses out on March 31st. I think you'll see 2 or 3, 4 million come out, the first week of March, and maybe another 3, 4 million the second week. So it is going to trickle out. And it's a one doser. So I think there's going to be a lot of people who are going to want that. But I hope if we only have Moderna, I hope they don't get to a pod and say, oh, I don't want this. We did have one person find out that we didn't have Pfizer, and he refused to get the shot and he walked out a couple of pods ago. So I think the Johnson & Johnson could produce that effect just because it's only one dose.
So Jack and the rest of the supervisors, I signed up yesterday for CVS, and son of a gun, I got a text message this afternoon that CVS has a whole bunch of vax, and I'm scheduled to get my first shot this Sunday. So the pharmacies are getting them. They're getting them.
Mhm.
Yeah, they finally freed that up. I think it's finally moving a little bit, which hopefully that'll help a lot of seniors.
Yeah, I wanted to add, a lot of it is opening up. And I think as supervisors, you have to talk to your constituents and let them know that they have to be diligent. Those that are diligent are getting appointments. And even on the state's website, it'll say no appointments available. If you click and click and click and click and click, eventually a lot of times one opens up. The other one is the 833 number that we post. If you call that number, because what's happened is people have booked in Utica, in Rochester, and all over. And as they cancel those, the state's website is very good. If they book a second appointment, they have to cancel another appointment. So don't forget, there's people from Rochester coming here and vice versa. Those open up. The 833 number, I've sent a lot of people to that. Somebody actually answers the phone. They're there till 10 o'clock at night. They ask you a few questions. They run you through it. They say, yes, you are eligible. Where would you like to go? I'd like to go to Albany. They come back and they tell you when it's available. And it's happened with a lot of people, including myself. I got an appointment within a week. So I think everybody has to realize that even though you don't see it, like they said, pharmacies are opening up. Things are opening up. So you just have to keep trying. I know it's frustrating, but it is definitely getting better for sure. So I just wanted you to know that. Make sure you let everybody know that.
Yep. Supervisor Adams.
I just wanted to know if this is the time to ask my question about the total number of people that have been vaccinated. I just want to understand the numbers a little bit better. So we're saying that at least 7,000 people have been vaccinated. That includes the pharmacies and all the state sites, as well as our own sites.
Yes.
And that's first doses only.
I believe so, yes. Yes, first doses.
That was last week's numbers, and I'm sure it's higher.
It'll probably be over 8,000 this week.
So do you think that, do we have a timeline for when we get to 60,000 people? I know it's a hard number, but I know that a number of other counties and states are announcing at this rate, we'll be through this qualification group, or we'll be through this, population in so many weeks. And I'm just wondering if there's a way to give that kind of guidance without being overly specific.
Well, first of all, anybody, depending on the vaccine, even if you're younger than 18 or younger than 16, you're not going to get the vaccine until so that's a significant portion of our population. Probably about 15,000 is my guess. There are people that are going to refuse to get the vaccination. So I mean, that 60,000 number, I don't think we're going to hit that. But I think we'll be able to hit all the people that want to get a vaccination or are eligible to get a vaccination. Probably my guess is, and Jack, correct me, I'm thinking sometime this summer, maybe late summer.
Yeah, I want to believe that, what's coming out of the White House and Dr. Fauci, that we'll have 600 million doses by end of July. It's going to be interesting because that, obviously with 330 million people in America, a lot of that 330 million are children. Are we going to begin vaccinating, kids, sometime in May or something, because we've run out of adults to do? I'd like to see it. I'm with everybody else. I'd like to see school open and be kind of sort of normal in September. So I want to believe at the end of July that we'll have herd immunity in Columbia County like we will in the rest of the state and the country.
Brenda, 8,260 people have had their first vaccine in Columbia County, according to the tracker. 4,117 have completed completed both vaccines. So we've got 4,117 people are finished. 8,200 have had their first.
So that's great information, because I think if it relieves some of the anxiety, if we can just say to people between now and, midsummer, we expect to have everyone vaccinated, and just be patient and keep trying. But, if everybody expects to do it in March, where that anxiety just churns.
Okay.
I got a quick question, Jack. The Johnson & Johnson vaccine, does that show limited efficacy against the strains? I know the other strains haven't showed up in this area yet, but if one were to be overly cautious, would one want to stick with the Moderna or the Pfizer?
Short answer is, if it was me, I want the double vaccines. I want the two. I really would, because I think that it's, one of the, I've been through both doses. The second dose definitely, can kick your butt a little bit. And what they talk about is your body's reaction to it. It can be an indicator of how robust your body's responding to it. And so the second shot did me in. I lost the Sunday. And I would want those two doses. I really would.
The one thing I will say, at least from reading about Johnson & Johnson, is that the efficacy is, depending on the variants or depending on the original strain, is anywhere from 70-some% down to 52%, but it's 100% effective keeping people out of the hospital. So you may still get the virus, but you're not going to get the severity of the virus.
I think the thing that's going on, from the science point of view, is that all three of those companies are working to develop a booster, with the recognition that these viruses are mutating, and there's going to be other variants that we don't even know about that are going to pop up as the summer progresses, and they're all working to develop that booster. So I think that even if you get the Johnson & Johnson, as Matt said, it is 100% guaranteed that it will keep you from getting a serious illness and keeping you from dying from it. So it's effective. Again, personally, I'd like to have both shots.
Mm-hmm.
Thank you.
The vaccine's not approved for children under 18 now.
Right.
So do you think that testing would be completed by late spring, early summer?
They're all in stage 3 testing now.
Okay.
Pfizer and Moderna are in stage 3 testing.
One of them is 16 and under. Is that Pfizer, Jack?
That's Pfizer.
Yeah. Sarah had her hand up, or has her hand up.
Yeah. I'm wondering about if you thought you had COVID or if you've had COVID, are they recommending, if you've had COVID, I guess you would wait, say for a booster, but if you just thought you had COVID, is there any possible of a reaction if then you go get the shot?
No, I don't think there's any reaction if you thought you had the COVID. And as far as if you have COVID, you have some immunity, the recommendation, and I emphasize that word, recommendation, is that you wait 3 months before you get a shot. Now that's not science. That's based on the fact that you got some personal protection, and why not let somebody else get that shot? So you can still get, if you've had COVID, you can still get the shot. But the recommendation is that you wait for the 3 months, just because you're liable to have some fairly solid immunity built up there. But I think if you think you've had COVID, you can get an antibody test. The antibody tests tell you whether you've had it. It's a very effective test for that purpose. That you've had it at all, you can get an antibody test. The CVS and Rite Aids, they all have the antibody test. If it's a concern, but it wouldn't be a concern of mine. I'd go ahead and get the shot if I had a shot at it.
Supervisor Hoatling.
Yeah, Jack, could you just speak a little bit to either a positive COVID or the vaccine, how long you're potentially protected for, as well as potential travel? I've heard from a few residents now, we've got the second vaccine, we're going on a plane to here. Are they required to then quarantine upon return, or do they not need to quarantine if they've either had it or had the shot within a certain time frame? Can you speak a little bit to that?
Yeah, so in New York State, the travel guidance remains unchanged. So if they travel, if they get a shot in wherever they're in within 3 days, and then when they come back within 4 days, they get a test, then they don't have to quarantine. But if they fail to get a shot in Florida or wherever they are and they come back, they're going to have to quarantine for the 10 days. Do I think that should be changed for people who have both the vaccines? Yes, it should be. And I think that it will eventually. The state sort of follows the CDC and they study the CDC's recommendations for a while, and then they put out their own guidance. So I think in the foreseeable future, it will change. But right now, it's in place.
So the same regulations, if you've had COVID or had both vaccines, the same regulations are in place for travel currently. Okay. And can you speak a little bit to how long you can expect to be protected after getting both vaccines and or a positive test?
Yes. The way I addressed this in the past, and I think it's apropos, is that we're all participating in a giant experiment. We really don't know the science there about this. And I think that I do see that they're saying if you get both vaccines, you have better protection than you would if you had a natural case that you actually had COVID. You have much better protection. So, and their sort of guess on how long your immunity lasts if you have a natural case of COVID is 3 months. So I would think that we're talking about, maybe twice that when it comes to, at least twice that when it comes to the shots, but we really don't know. And as time goes by, I'm sure as more people get vaccinated, they're gonna set up some studies where people have an opportunity to go in and give some blood to find out what their level of immunity is, so that we can figure that one out.
Thank you.
Okay. At this point, David Harrison, do you have anything you would like to add?
Thank you, Chairman. Just emergency management continues to support the vaccine effort and mainly in supporting the health department. We've been doing supply runs for people who are under mandatory quarantine if they absolutely can't obtain their own food or other items, and also supply runs for the pods that the health department are putting on. We're also assisting along with tourism and the public information part of this whole thing. And one thing that you're going to see coming down the line tomorrow is that people searching for pod links so that they can register for appointments are going to see a notice that says that the health department is only going to put the new pods out on Tuesday and Wednesday mornings between 10 and 11 a.m. So people don't have to continue searching, 24/7 all week. Anyway, they'll just have to search during those hours with the understanding that, if there's weather conditions or delays in the vaccine supply or whatever else happens, as we know, anything can happen. There may come a time where a link has to be posted other than during those hours, but for the most part, Director Mab wants to do it during those hours. That's about it.
David, can you just repeat those days and hours for the pods?
Yes, it's going to be any new link for the week is going to be posted on the health department website on Tuesday and Wednesday mornings. If there is a new pods that are going to be conducted that week, and it's going to be between 10 and 11. So
We're trying to relieve people's anxiety because people were on the computer all the time trying to find the links, and at least if we tell them that these are the times the links will be posted, they can get on with their lives.
Jack, when you thinking that all grocery store, all restaurant store, grocery store people, worker get a part, they get it yet or not?
Grocery stores?
Yeah, the grocery stores all like that.
We did a focused pod a couple weeks ago where we contacted major markets and we gave them slots, and we asked them to focus on their cashiers because those folks are the ones who had the greatest exposure, which they did. It was a very grateful group, and they are eligible, and
they can get an appointment.
They're 1Bs and they can get in through our links. I guess there's this question. We could debate this question the rest of the evening. Is it fair if somebody's a teacher and they're eligible, do we do a focus pod for teachers, or do we just open it up such a limited number of vaccines to everybody who's eligible in that category and say, here it is. Our thinking is if we establish the links on either Tuesday or Wednesday between 10 and 11, at least everybody knows, everybody has an even shot. They have an equal shot at these slots. They're incredibly limited, and it's still, the luck of the Irish and just keeping, as Rob said, just keep trying, clicking on there to get in. It's a fair way of doing it. On the other hand, if you look at the people who are in category 1B and start breaking them down in terms of their risk and exposure, then I think teachers have a pretty high exposure because they're locked into a room with 25 kids.
Right.
I think grocery store clerks have this constant movement of people past them. I think they have a high exposure too, and it may be higher than a lot of volunteer firemen who have jobs that don't put them in the public. But so we struggle with that all the time. How do we make this fair? Do we use the risk and exposure formula, or do we just basically put it out there and say, here it is, sign up?
Okay.
Yeah.
So you can sign up now, right?
Yeah.
Okay.
You saw I sent out a memo today to department heads, and I copied all the supervisors, but we just wanted to reinforce the fact that we are going to follow the state rules. We're not going to go astray from those rules because we could get fined. Jack has never had any intention to go astray. We're following the rules as they're set forth by the state of New York, and we're going to continue to do that because we did have some departments who felt that their staff needed to get vaccinated, even though they weren't on the state list. So.
Well, and I think that one of the things that sort of clouded the waters a little bit on that one is that there's at least two definitions of essential worker here that we're working, and there's what the governor calls essential workers, 1B. It's very well defined, and then counties can also designate essential workers. Obviously in February, a guy that drives a plow is an essential worker. He's a really important guy. But those kind of people are not necessarily on the essential worker list that the governor comes up with. And that's what we're living with. As we've been told by the state health department, stay in your lane. Do the people that are qualified based on what the governor has to say. And that's what we're doing.
Anybody have any more questions for David Harrison? Sorry, Supervisor Mettler. You're on mute.
Yeah, I'm not sure who the question is for. One was, I think, maybe for Rob Lagonia. Someone here gave us a New York State number and I didn't write it down. Can somebody, whoever gave that number, repeat it?
Yeah, hang on.
I have it. It's 833-829-7226.
Excellent. So my other question.
Very helpful on there. It's actually really a pleasant experience. I was on and off in less than 10 minutes with an appointment.
Yeah, I've heard that from people, so I want to be able to put that out. So here's another question, and I feel a little embarrassed asking it because it's nowhere near as urgent as all the other things we're talking about. But I'm beginning to get inquiries with regard to the summer. Can we do a summer program? Can we do a camp? Can we do a music program? I know at about this time last year, the county took a strong view with regard to camps. Can anyone on the call give me any projection of where we're going to be? Maybe you can't. I mean, as far as I know, the limit on gatherings is still 50, unless it's changed. But can someone comment on that? What the summer is going to look like? I realize it's a difficult situation.
I would defer to Jack on that.
Thank you, Matt. I want to see camps happen. I think we just have to try to find our way back to some normalcy. As long as the numbers keep declining like they have been, the big unknown in all of this, the ringer in all of this, is the variants. And they've been saying for a couple of weeks now that the UK variant it spreads more quickly, more easily, and it's starting to spread across the country. And they say by the end of March, it's going to be the predominant strain and whatever. If it doesn't have that effect and the numbers stay down, I really want to see camps happen. And Ed Coons, who runs the environmental unit and oversees camps, wants to see camp happen. We've been pestering the state health department to make sure that they're working on guidance for us so we can move in that direction. Some of the big camps, the ones that are for profit, Camp Pontiac, for instance, this is the time of the year they hire their staff. And so they needed to move forward and we kind of gave them the green light. With the understanding is last year they hired staff and we couldn't get open. So if the numbers keep going down, we want to see camps happen.
Do you think that it'll be mandatory for the staff to have vaccinations?
That's my question, yeah.
I don't know that. My short answer, it's a reaction to it, is no. I don't know that it's going to be mandatory they have it. We may require some testing. As you know, we're doing high-risk sports now in the county, along with most of the rest of the counties around us, and we are requiring weekly testing of the athletes. And the last I heard on Wednesday that the schools have conducted something like 1,370 tests of athletes, and all of them are negative. So this has been a good experiment. It's been a positive one, and it may be something that we hold true for camps. We'll test the staff coming in, and then do we test participants too? If the state can make available that kind of test kits, we might. If it helps get us open, yeah, I would support it if it helps get us open.
Jack, do you think that we would follow the rolling average of 4.0 for summer camps, just like they're doing with like we're doing with sports?
Yeah, I mean, as we all know, what basketball looks like, the close contact, they're trying to wear masks, so yeah, I'd say that 4.0 would be a reasonable number for us to, if it gets above that, for us to change things If it stays below that, yeah, I think it's reasonable.
Mhm.
And if I can also ask about summer programs like a concert series and things like that, do we think that the limit of 50 people to a gathering will be raised?
Possible. I mean, I've been told that health departments can approve weddings for up to 150 people, depending upon the capacity of the restaurant. So there's already some movement in changing that kind of gathering. I have yet to see any guidance from the state on weddings, and we're getting probably 2 calls a week here from people looking for guidance because they want to do this. So I think it's possible that by the summer that we could see that number bump up. I think that I'm thinking about the town of Greenport because I've gone to some of their concert events there. It is possible to spread 100 people out at that park and have them spread out well enough that there's a lot of distance between people. So I think we would look for the town to come up with a plan how they're going to do it. But I would support pushing the number up.
Mhm.
Okay, good. Thank you.
Now, do I understand it with the wedding venues, Jack, that if you go to a wedding, you have to have a negative test prior to?
But there's been no such guidance out on it. That's
Okay.
But there's been nothing in writing.
You know, I think it's important, Supervisor Mettler, as a supervisor, you're going to have to make that decision with your board, because we could be going as we are, which is terrific, and I'm thrilled that we're all going in the right direction. And you could plan to do your summer camp, and something happens, and you can go the other way, and then you're doing that. So I can say that my town, we didn't even put it in the budget for this year. So I just think it's a little early. We don't have enough guidance, and I think you're going to be. I support opening. Don't get me wrong, but I think by the time we get the guidance and you try to figure this all out, we're running out of time, and we could be back in a situation like last year where we're all sitting around. What are you doing? What are you doing? What are you doing? We just made that decision early on. I think you're all going to have to try to sit back and decide that amongst yourselves within your boards. We don't have a huge summer camp. Some other towns do. So I think it's something you're all going to have to kind of make that decision on your own as well, understanding that it could go the other way. So.
Yeah, understood. Thank you.
And we're kind of going the opposite direction. We're saying as long as the state and the county allow it, we will authorize moving forward with it. But once you start hiring people and people are depending on you for potential childcare for the summer, it's a tricky one. Now, Jack, my understanding that Governor Cuomo did at least make a statement that summer camps were going to be allowed. Again, there was no guidance behind it. There was no real direction, but he did basically state that that's what he's going.
Yes, he supports them happening.
If you remember correct, last year, we waited to the 11th hour and they did allow it to summer camps, but for most of us, it was too late to do anything because the guidance, didn't come out until very late.
And I think that's going to be the same thing this year. But we put it in the budget. It's easier to pull it out than put it in. Because we do have a, good size camp and park out there, and a lot of people want to use it. Not only people from Greenport, but from surrounding areas. And the Stockport, and the music at Sunset, that was always a big thing. And like Jack said, we have the ability to spread it out, but it's also a lot of, who's going to be minding the store, who's going to be watching this and making sure that everybody's not there. We have the concession stand, and we're not going to open the concession stand, and maintaining the 6 feet distance. There's a lot of thought that needs to go into this to maintain the safety of the residents. And we took a lot of heat for closing the park and not opening it up, and I'm still standing. So you have to make the right decision sometimes, no matter, how other people feel about it. And Jack, thank you for everything.
You're welcome.
And Jack, camps are allowed to continue. We'll work with you like we normally do, but also how the schools are working with you as far as safety plans and prevention and all that.
Yeah, I think it's important to, we were just discussing this on the superintendent's call on Wednesday. we have not had a case that we can clearly establish is associated with a school bus going to school. And some of those kids, like Taconic Hills has the second biggest geographic area, has the bus routes cover. Some of those kids are on the bus for an hour, sitting with 22 kids, all spaced out with masks on, and we haven't had a single case. And I mean, what is a bus? It's a big box. It's a big box where all those germs can float around inside, and we haven't had a single case. I mean, I think I admit I was predicting schools would close down by October. It didn't happen. And I think we can learn some lessons from what we've learned from schools when it comes to camps. And it comes to other, speaking to Kathy, the issue, concession stand. How long does a person actually stand next to somebody at the concession stand? Because remember, exposure is 15 minutes, less than 6 feet. So those are all things that are possible. You can think through that stuff. And I think we can put something in place that makes it happen. And we all just crave those normal things, and especially kids, especially the kids.
Patsy?
In my park and my summer playground, yeah, and I'm like Kathy, we both got pure grief over it because we shut it down and so forth. And I get like 130 kids that sign up, and I can't imagine us being able to have social distancing unless I put them, 6 feet away and stuff like that. So as quick as we can get guidelines would be wonderful. I want to open it up, and I got to start, hiring people and so forth and so on. The other thing is Little League, baseball, softball. We do soccer. The people play soccer and basketball constantly at our town park. And yeah, I put snow fence up and around, so they broke down the snow fence. I let fall ball happen, and a lot of people did Little League, played baseball. So I think that I didn't hear any guidelines on that at all. And the governor hasn't said anything about sports, even though they're outside. So I really hope that we can hear something soon. If not, I'm going to have to go to Albany and ask him myself. But but I think the quicker we know, we got to start hiring. We're going into March. After St. Patty's Day, and I'm recuperating. We got to get going.
Well,
so let us know, Jack, as soon as you can. I'll tell Ed.
Your homework assignment is to go to Albany and talk to Andrew and see what you can do with him. And,
you come with me, Jack.
Well, to that point, though, I think the chancellor from the state university system last week was talking about spring baseball. Mm-hmm. So I have received a few phone calls from folks running little leagues wanting to know. I think baseball is going to happen.
I think so too. I really do. The other thing, I was on a school meeting the other day, Jack, and with Ichabod and other people, and I agree. The schools have done a great job, and the kids have done wonderful. And I think that we can actually say that then that contact, they might have been exposed, but it's not from classmates. And it's not from, it's from some other buddy that came in or whatever. So I really have to say the schools are doing a great job. Every school system. So kudos to them, I told them.
Yeah, I agree.
Supervisor Chimides.
Yeah, I was just going to share Hudson's experience with summer camps. So I can't predict what this summer will be like, but we ran camp over last summer. We found it to be very successful. So that we changed the camps a lot. Instead of having, 100, 200 people all at Oakdale, we broke it into sort of a bunch of different smaller pods. So we used a bunch of different locations of groups of 10 students, 15 students, so they could distance at different locations, made it as outdoors as possible. And we found that to be a very successful program, in part because we felt like the kids were gonna find each other and socialize anyway. And so this is a way for them to do it in a productive way where adults could sort of help make sure that they were following all the guidelines. And it seemed to be very useful for us. So I think the plan is to try to do that again this summer for Hudson.
Good. Thank you.
I think it might be nice, supervisor committees, if you could share that pod plan that you had with any other supervisors who was interested in it. And again, I think this calls for creative thinking, out of the box stuff. And I think there probably isn't a single person in this meeting that doesn't want to see camps happen. So, let's work it through, find a way to make it happen.
So Michael, did that include swim lessons? Or were swim lessons eliminated for the summer?
We did have lifeguards. I don't remember if there were swim lessons. I'm not that involved with the details, but there was swimming at the beach with lifeguards. But we moved a lot of the camps were no longer at Oakdale. So we got we put up like a big tent at a few different locations, like the Charles Williams Park, there's the waterfront park. So we sort of had like a bunch of mini camps that would have like a porta potty and like a tent, like one of those like wedding tent kind of style things, so they could get out of the sun with some picnic tables. So we tried to sort of break that up that way. But yeah, there was some swimming, and certainly Oakdale just got used by the public. We also felt like the people were going to go to Oakdale anyway, even if if it seemed very hard for us to close Oakdale, the people would just be constantly going in there anyway. And so it seemed easier to have lifeguards and to sort of manage that process. And we sort of like staked out on the beach. We put a bunch of umbrellas out at 6 feet distances to try to keep people separated. That was sort of our tack, was more to open things up in a certain way.
Okay. Thank you. I'm gonna ask Rob Lagonia, do you have anything to add?
No, I don't think so. Good discussion. But if anybody has any questions, let me know. Thank you.
Supervisor Sterling?
I'm good. Thanks, everybody. Thanks for doing that Tuesday, Wednesday group. I'm really appreciative. A lot of people are. Thanks.
Yeah. Supervisor Holding, since you're on the EOC.
Nope, just want to say thank you to everyone for your hard work. And I agree with Sarah. It's great that we're going to have a 2-hour window each week that you need to check. And other than that, not have to be on all the time. So thank you for setting that up.
Okay. Kelly Baccaro, do you have anything you want to add, since she's been working so hard with getting people?
It's been my pleasure getting people signed up. There's nothing more I can say than the appreciation of the older people is amazing. And I enjoy doing that. I will let you know that the call center today had a lot of fun booking people. They found spots for them at CVS and the different pharmacies. So if you do have people that are having a hard time, they don't have access to a computer, the call center is willing to help them as best they can as the pods, open up at CVS, Walgreens. So they can help. They can help people over 65 that don't have computer access, as long as there's openings. So tell people to feel free to reach out to them, and they will look to see if there's anything available on the state website for them, and try to get them in. But otherwise, it's been my pleasure. Thank you.
Thank you, Kelly. You're wonderful.
Thanks.
Thank you, Kelly and Sherry and everyone.
Thank you, everyone who doing this job. Thank you.
And I want to say that the call center has not been around that long. I mean, it's kind of hard to believe. It's just been a matter of a month or so. It has become an invaluable thing for us down at the health department. It's taken such a load off of us, and I'm glad I'm glad they're enjoying the work. It is pretty rewarding to put shots in people's arms. I agree with that. And I also want to say that Dave Harrison and Adam from tourism, invaluable, helping us with the website, updating information on it, trying to move things around and making it cleaner for people. Just terrific resources for us. So just really glad that we have them, and just thank them for what they're doing for us.
I also want to thank, everybody knows here, the faces here, but I don't think everybody realizes what an amazing job David Harrison does for us. I can't even tell you what a great job he's done. He runs the meetings. He's just fantastic. I have the utmost respect for him. And Kelly has just been invaluable as well. So I want to personally thank both of them. They're just terrific. So I don't know that everybody knows how much work they do behind the scenes, but they've been tremendous. I'm not saying that everybody else hasn't. Everybody has, but I want to give a special thanks to them. So that's all. So thank you.
Thank you.
Okay, and let's not, I mean, Jack has been working his butt off 7 days a week to the point where, you know, you're getting a little grayer, Jack.
A little grayer, and it's kind of crushing me. I will tell you a story. Yesterday, I was standing next to Kathy Pirro at one of our reception things, and some of you know Kathy, and we were just talking and whatever. And these it was a 1B pod, second things, and a group came down the hall, and one of the gentlemen, I think he was a second or third in the line. We have chairs for him. So he sat down, and he looked up and he said, "Kathy Pirro," and he comes running over, and apparently he lives in Cloverk now, but he was a lawyer in Hudson. He was very involved with planning and whatever like that. And he's, you know, they did the elbow bump and whatever, and they kept talking as he sat back down in his seat. And he says, I just want to tell you that Jack Mabb, he's doing an incredible job. And Kathy kind of looked at me like, and I said, you know what? I certainly am. And the guy jumps up and he runs over and he gives me a double elbow bump. And he says, I'm being sincere. I didn't know it was you, man. He says, I didn't know it was you. You're doing a great job. So those are the nice moments.
That's awesome.
And then there's the email I got earlier this afternoon, and I think Tistra was CC on that email, and I just, you know, that stuff bothers me. It does bother me, but I'll get over it. I was thinking about all kinds of responses, and you know, Adrian says, "Don't you dare! Don't you respond! You're not going to respond. I'm not going to let you respond." And I'll go home tonight and have a few glasses of wine, and I'll be all right.
And one thing I want to say on a personal level, and I know I said this on the EMC calls, but I just want to also say it publicly. My family and I all got COVID, and we're all under isolation. And I have been almost in tears a few times in talking to Jack and his crew at the Department of Health, because they're not only doing their job, they really care. I mean, they're going above and beyond, out of their way. Are you supported? What do you need? Do you need food? Do you need medicine? Do you need support in any way? And it really does make a difference, Jack. And I was able, unfortunately, to experience it firsthand. And just kudos to everyone in your department. It really is heartfelt, and it really feels supportive when you're kind of all alone, isolated, not sure what's going on, and you get a call from you guys. It's kind of the highlight of your day. And your staff, everyone I've talked to multiple people there, and everyone just amazing work. So thank you.
Thank you.
Hey, Chairman.
Yeah.
I'm sorry. I would like to also thank the Board of Elections, Deneen Panatis, and her staff have been the volunteers or have been working in the call center, and they have been fantastic. Right now, the Board of Elections is down, you know, is quiet, so they have the opportunity to work in there, and they've been most helpful. So I just want to, you know, say thank you to them as well.
Yeah, just about every day when I go in to visit, I see Ron and Ravonda are working the call center. So.
What about Mark? Mark's there too. I don't.
Yeah, Mark is he's part of the emergency management office. He's one of the deputies to David Harrison. He's been there every day. So I just, in closing, I just wanted to say that, and you saw this, we extended the 50% and 25% for DSS for another 2 weeks. If the numbers keep going the way they are, the next time around, we may increase it. But as you know, we've had a couple of instances of positives in our offices throughout the county. So I'm just being cautious. But you know, we'll look at the numbers, and you know, we'll make the decisions based on the numbers, and we talk about it at the EOC as well. The other thing is we'll probably, I mean, I've been extending the state of emergency since March, and you know, I'm going to continue to extend it as long as COVID is here, and for a variety of reasons, out of caution, but also for funding reasons. So So with that, that's all I have. And I just want to thank everyone. We'll probably do this again in another month, if it's okay, just to keep everything posted and up to date on what's going on.
Okay,
So thank you all.
thank you.
And
Thank you, Chairman.
thanks, Jack
Thank
and
you.
Dave.
Thanks,
And
everyone.
Jack.
Thank
Thanks.
you.
Good night.
Night.
night.